Hi ladies, welcome back to Fertility Mom. Today we're going to talk about a hot topic, something I get asked about all the time, which is coenzyme Q10. I get asked all the time, does it work? When should I take it? How does it help with egg quality? So we're going to talk about some of these things today. Stay tuned. So there's actually a lot of conflicting information out there about the use of coenzyme Q10 and fertility and improving egg quality and helping you to get pregnant. So we kind of have to take it back from the beginning, which is back many decades ago when embryologists and many doctors around the world really started to kind of put together this idea of the energy making capacity of the egg really being related to its overall quality. So for those of you who have been following me for a little while, or if you've been to my free fertility masterclass, you kind of understand this whole mitochondrial business. I talk about it a lot. It's one of my favorite things to nerd out over. But mitochondria are the little dudes inside your cells that make all of the energy that your cells need to do everything they need to do. Now, these mitochondria are especially important in your egg cells because they have 10 to 15 times more mitochondria in each one egg cell than in any other cell in your body. And that's because that's how much energy is needed when you are having a pregnancy, when you're creating a baby. So this idea of the energy making capacity of the mitochondria, of the egg cells, and its quality really started to kind of gain traction in the 1990s with a lot of different studies being done to kind of see where this theory would take us. Over the past several decades, many studies have been performed looking at the use of COQ10 and whether or not this improves egg quality and then live birth outcome. So a lot of these studies first started in animals, and then of course we do have some human studies as well. Right now we have seen that the use of coenzyme Q10 helps to improve embryo quality as well as egg fertilization rate in IVF. It also decreases the amount of canceled cycles and decreases the amount of chromosomal abnormalities that are found within embryos themselves. Some animal studies have shown that there is an improved live birth outcome with the use of CoQ10, but that doesn't necessarily mean that that is true in human models. And since we don't have very many randomized controlled trials done in humans, while we have seen better embryo quality and better fertilization rates, live birth outcome is something that we really do need to take a look at over longer periods of time with more study subjects and more well-done randomized controlled trials. So we still need some more evidence on this. Obviously, this is not something that we just kind of call it after a little while. We kind of need to come back to this over and over again. But from what we know now, coenzyme Q10 can be a very helpful part of your supplement protocol when you are trying to get pregnant. CoQ10 is used in every single cell of the body, but like we said before, the mitochondria amount inside your eggs is 10 to 15 times more than any other cell in your body. And a good portion of your egg being able to do what it needs to do relies on how healthy, how well performing those mitochondria are. There are two forms of CoQ10 that you can choose from. There's Ubiquinone and Ubiquinol. Now, Ubiquinone needs to be changed into Ubiquinol to be actively used by the cell. So for many, many years, it was thought, well, Ubiquinol must be better than Ubiquinone for that reason, right? That the body needs to change Ubiquinone into Ubiquinol. So if we just take Ubiquinol, then that will absolutely be better. To make a really long story short, they are both shown to increase the level of active CoQ10 inside your body, inside your blood, but there is some disagreement in studies over which form is better than the other. In some studies, it's suggested that about 20% of people absorb ubiquinone better than ubiquinol, but the majority of what we know at this point is that ubiquinol is better absorbed, increases your blood levels of CoQ10 faster, and at a lower dose than ubiquinone does. Overall, what this means is that you can take either ubiquinone or ubiquinol. If you're taking ubiquinone, you may need to increase your dose a little bit. For me, I do recommend to my ladies to take ubiquinol if they're able to. Some of them choose to take ubiquinone, and that's fine. We just increase the dose a little bit. Let me know down in the comments if you're taking CoQ10 already and which form you're taking. Are you taking ubiquinone? Are you taking ubiquinol? Did you previously know the difference between these two? Let me know down in the comments. I'm super curious. In terms of the dose that you should use, that's going to range change and depend on what's happening for you, your medical history, your fertility history, whether or not you're doing IVF, all sorts of different things. But for the most part, the clinical studies that have been run in the fertility world are between 200 milligrams to 600 milligrams per day. Now, if you're taking anything more than 200 milligrams per day, I recommend that you split that into either 2 or 3 separate doses, depending on how much you're taking and depending on the brand, the quality, all those things. And I recommend that because your body can only absorb so much CoQ10 at once. Now, just a little note here on the dosage range. Clinical trials for the fertility world usually use between 200 and 600 milligrams per day. Clinical trials being run for other things like Parkinson's, Alzheimer's, heart disease, and things like that are using a much, much higher dose over longer periods of time. So we're talking doses up in the 2,000 plus milligram per day range over a span of 2, 3, 4, 5 years. So the dose 200 to 600 milligrams per day is kind of on the lower end. Now, I do not recommend that you up your dose into any kind of range that is higher than 600 milligrams, simply because we just don't have data on that for what we're particularly doing, and we like to have our evidence guide our practice. You are going to want to take your CoQ10 with food, specifically a food or a meal that has fat in it, because it is absorbed better when there is fat present. You're also going to want to make sure that the last dose of coenzyme Q10 that you take during the day is going to be before 2 p.m. in the afternoon, and this is so that it doesn't disturb or get in the way of any of your sleep. If you're finding you're having a little bit of trouble sleeping, back off the dose a little bit until you find that you're sleeping back to normal. Some common side effects that I see with CoQ10 include difficulty sleeping, stomach upset, diarrhea, loss of appetite, things like that. I would say the most common thing that I see is difficulty sleeping if I do see a side effect with this. And again, if that's happening for you, just back off the dose or drop it completely for a couple of weeks until you regulate, and then you can start working it back in smaller and smaller doses, making sure to dose it in the beginning of the day. There's also the potential that things like CoQ10 can get in the way of how some medications you're taking can be absorbed or how they're working, and this includes things like blood thinning medications like Coumadin. So if you're taking something like that, or you have kind of a complicated medical history in the blood clotting kind of arena, then you really want to make sure you're working with somebody who can help you navigate exactly what you should be taking, what dose, what form, how you should be taking it, all those things. And because you have been asking me to help you with that since 2019, I'm finally coming out with something for you this Black Friday. It's going to be super special. You're going to be the first ones to get your hands on it, and it's going to help you to figure out exactly what your personalized fertility supplement regimen should be, why, for what issues, the dose, the form. All of these questions that you ask me every day is going to be answered in this Black Friday special. So keep your eyes open for that. Make sure you're subscribed here and on my email list. And if you haven't yet been to one of my fertility masterclasses, make sure you're coming to the next one. We'll actually be able to talk about what's going on for you, and I can answer your questions there live and give you what you should be doing right then. Okay, ladies, that's it for me today. I hope this video was helpful for you. Let me know down in the comments, what are some other videos that you would like to see from this channel moving forward? Let me know, and we'll get that going for you. All right, ladies, I'll see you in the next one. Bye.